second day of webinar. And as you know, the Government College of Nursing Mysore initiated this program, and Nanda Prakash is the instrumental, and Soumya Madam is hosting this. And outset, I'm thankful to each one of them, giving opportunity for presenting shared care and electronic health records. Till yesterday, I think you have gone through some computer knowledge as nurses and further how it may be useful in recording. Presently, I am working as assistant professor in College of Nursing AIMS, Bhubaneswar from last 10 years. Before that, I was from Manipal. I may know little bit of, means I am basically from Karnataka, that's why I know the Kannada. So any questions can be raised at the end as post is how it is stored. Straight away, we'll move on to the topic on shared care and electronic health record. If you look into the care, it cannot be isolated somewhere where we can only caring our patients. Now the healthcare is a global science. Everywhere, person will be come across with illness and need some hospitalization for the accurate treatment. Most of time you can find that people reaching hospital it's bit delayed. Once they reach it, the treatment initiation is delayed. Even after treatment in time started, also diagnosis may went on error. Maybe some of the facilities like CT scan, MRI scan may not be available, or maybe some blood test also may not be available. To get that blood test to be done, you have to seek some agency or you go away and get the test done. By the time is already consumed and patient is no more. This type of uh, hiccups in the healthcare sector, the best solution is shared care. Coming to the electronic health records, that is the basic topic of today's entire session. As we progress in our um, slides, we come across with electronic health records. I'll just go with some brainstorming session and started with some objectives. One minute, it's somewhere stuck. Objective of the session: shared care and electronic health records, challenges of capturing rich patient history in compatible form, latest global development and standards to enable lifelong electronic health records to be integrated from disparate systems. This is what the objective given from the organizers. Move on to the some question answer session. This is what they have told to have some 3-4 questions so that we can involve everyone to the board. First question is, what is the problem with the existing health records? If you see the picture, it is clearly indicate how the health record happening in our clinical areas. Maybe nurses or maybe SRs, everybody take a cardboard or case file and they'll scribble that. Now the question is, what is the problem with existing health records? First one is easy recording at bedside, difficult to retrieve and store. If you miss recording, can be substituted later. Out of which one you will opt? So what may be the your takeoff in these three? One may be the suitable answer, other two may not. Answer is B1, Ankita Rai has said. Very true. Answer is B, because difficult to retrieve and store. If you see our CS MRD section, lot of paper with the files, and when patient comes a second time reporting to the hospital, we may not able to get a real file because of numbering error, or maybe number properly storing somewhere misplaced by somebody else. So that may lead into a lot of issues. So retrieving is really problem. storing also really problem. And as per the government norms, we can store maximum 10 years, then we have to destroy. This is what the problem where after every 10 years, we may ask a new registration. Move on to second questions. What is the requirement of digitalization of medical records? Here, digitalization means transferring hard copy into computerized soft copy of whatever the data. Now, for example, the four answers are there here. For easy retrieval of clinical data, able to store more than 10 years, reduce the manpower at MRD section, increase the manpower in clinical area. So the first saying is for easy retrieval of clinical data, which we have already seen in the previous slide. If it is electronic records, a retrieval will be easier one. And next second one is able to store more than 10 years. That is also true because where hard copy we can store only 10 years. That's what the government norms. And again, new registration we may ask. Reduce the manpower in MRD section. This is another area why because MRD section we may have the people, more and more people if the hospital is increasing a number of patients attending in OPD. Last one, increase the manpower in the clinical area so that MRD people can be substituted in the clinical area. Maybe each ward, one clinical staff, or maybe increase the nursing manpower so that they can record. If you see all of this, some extent true. That's why we can say not one single answer, all the answers are partially right. Move on to next slide. EHR stands for Electronic Health Records. How it is complicated for nurses to practice. So we wanted basically all nurses records should be in electronic form. So if you're looking at that long term, really beneficial, but at present transferring from hard copy writing to soft copy, that is computerized write-ups of clinical data, how complicated for nurses to practice. First one is not aware of recording, need orientation and training. B, demand forceful adaptation in recording system. C, fearful of wrong recording, lead to legal battle. So which one you take it home out of three? Yeah, here as such, all the three are some or other nurses may face in their practice, not aware of recording, need orientation and training. Yes, few people who are not at all exposed, they need orientation. Demand forceful adaptation in recording system. It may not be that much right, but still few people who are experienced maybe more than 20 years, not aware of this immediate changes, they may not accept easily. That's why it may be for them, it is a forceful adaptation. Then fearful of wrong recording lead to legal battle. This is where most of the nurses scared off. Whatever I write ups, it may be grammatically not right, one thing. Second one is I may not get proper words to express. Last one is that whatever my recording may went wrong, I have to face the legal battle. This all the three are partially right, but at the same time, most of the nurses more fearful of last option, that is fearful of wrong recording lead to legal battle. With this, I will go to topic Here one clinical scenario is that, just for to coming back to the topic, how EHR or electronic health record is beneficial. Mrs. Shruti Bhatt, 52 years old female, homemaker, 64 kg build, reported to skin OPD, discoloration of left thumb fingernail and the tongue in September 2021. Nail biopsy is sent, histopathological examination of nail shows no significant metastasis formation. Means they're suspicious about that skin discoloration may be uh, carcinoma of skin, and for that they have sent the biopsy, but biopsy report indicates no metastasis formation, which means that no carcinoma. Move on to next. Same patient reported April 2022 to the with history of abdominal pain. After PV examination from the gynecologist, smear is sent and they said there is no finding significantly, so better they can go and show to general surgery. Patient went to general surgery OPD, shown to general surgeon, and during palpation they identified this umbilical hernia because the painful in the surrounding the umbilicus, and they asked her for ultrasound. Ultrasound is done, they confirmed umbilical hernia. All the blood tests suggested to undergo for surgery. As you know, some blood test has to be done, HIV, HbSAg, then routine like CBC, renal function test, and electrolytes. This and all the basic has to be done, and that all complete and come for the surgery. That's what the suggested by surgeon. Same patient after a week, that is first week of May, came prepared for the surgery with all report to surgery OPD. On examination, she ruled out umbilical hernia, suspected appendicitis, and planned for emergency appendicectomy at 8 p.m. on same day. But when near to the 8 p.m. at night, due to some RTA neurosurgery case is taken, and her appendicectomy is rescheduled at 9 a.m. next day morning. As per the plan, surgery is done. The her view shows that she have advanced stage of malignancy, and removal of appendicectomy not possible because of clustering of cells and not able to cut in between, and we cannot lift. As I said, it is a laparoscopic, so they not have that much access to the appendix. So what they have done, they sent the biopsy and waited for the report from the histopathology. Histopathology report confirms signet cell carcinoma of large intestine. Then as soon as they confirmed it is a signet cell carcinoma, tumor marker, sigmoidoscopy, gastroscopy, etc. is done, and tumor marker also higher side. But during gastroscopy, they confirmed it is not the intestine area, it is the duodenal carcinoma of origin of tumor cells. So the carcinoma basically started from duodenum. Now it is spread all over lower abdomen. As I said, it is advanced phase, nothing much more than fourth stage. Then again, they wanted to confirm whether the same carcinoma is spread out some other organs. So CT scan with the contrast is done to check metastasis formation, other organs like lungs and vagina. And the result is not that much significant. Planned for a 6 cycle of chemotherapy. Then, based on the physical condition, they planned for surgery later on. This is what some basic clinical picture. Now come back to the junk. Shruti Bhatt is from Udupi and she want to go and take the treatment from Udupi. She don't want in Bhubaneswar. So now the question comes, how she can proceed? Basically, two options. One is that, okay, we'll take all the report and go and show to physician there. But another option is that we can share her all the clinical records through maybe directly to the patient or maybe the physician who is treating over there through his email. And sharing is not just limited only lab reports and CT scan report, also clinical data, that is surgery is done, surgical data, and maybe video recording. As you know, laparoscopic surgery means we can get the video of entire inner environment of the abdominal organ. So that will be recorded in the monitor. That can be taken in a pin drive and maybe shared with the email. All these are what I am talking means it is a shared care. Patient is not comfortable at Bhubaneswar doesn't mean that we have to consider. Patient can go wherever he or she happy to undergo surgery. At the same time, this clinical data, which already done, patient paid money, can be shared. This is what I just want to bring your notice with all. Now I move on to next, patient record system. When we're talking about patient record system, that is nothing but simple recording system. So here some of the, you can see the old MRD picture in the slide, how it is. Patient record system is central to all the information and communication among the healthcare professionals. Quality documentation and reporting enhance the efficiency of patient care. If there is each shift, nurses should be recorded, taking over, handing over. Most of time, what happens? Patient shifted to radiology because of CT scan or MRI scan, but nurses fail to record in their nurses chart. So they consider no, it is patient shifted hospital only. It's a radiology department. No, it is wrong. We have to record because once patient is admitted to hospital till discharge, is any deviation, fell, injury, everything is responsibility of a nurse. Which means that patient shifted to CT scan, there patient may be collapsed. Should not come to the nurse because she is not there physically. So what we have to do is we have to record. Patient shifted to CT radio diagnosis or radiology department for the CT scan with the timing, so that as soon as patient received again you have to record. So these are the important because patient is out of your area. If something goes wrong, you are not held responsible. Efficiency and accuracy of documentation increasingly rely on computer technology in healthcare. In 1990s, computer for nurses, everybody laughed, why nurses computer? No, not required. But now computer is essential for nurses. Now, furthermore, all recording in the clinical area, we need to adopt or change, transform into computerized recording. This is going to happen shortly. You can wait and watch another 10 years. Definitely, all the government and private, everywhere, clinical recording is not on hard paper. It will be going to be in computerized. Information management, storage, distribution is the fundamental role of information system. Role of information system is very important here. So overall, what I mean to say, we need to record everything in a computer, can be shared, can be recorded. Move on to next slide. If you see in this slide, the right side one picture is there. That is nothing but nurses chart, where we record manually. So record system is like this before, but now recording system going to change. Record means something written, furnishing evidence or information. Documentation is any written or printed or electronically generated. This is where I'm talking. Till now, we aware that only written document or maybe printed, maybe circular, printed document. But now we are telling that electronically generated information about patient and service provided to patient. Your observation, patient may be how, whether he is conscious, whether he is taking care of self-care, all these are your observation on patient. That is clinical data, because that is very important for progression of patient. Through documentation, nurses communicate their observation, decision, action, outcome, and outcome actions to the patient. So overall, what I mean to say, your clinical data you may not aware, but patient progress is depends on your clinical data. Now the types of documentation system, basically two types: paper based and electronic based. Paper based means source oriented record, where source is the patient, means based on the patient observation you are recording. Second one is problem oriented medical record. So what exactly patients face the problem? For example, I have stomach pain, I have headache. This is what we consider as a problem. Based on the problem oriented, your recording will be the POMR. That's also another type of recording system. Then charting by exception. So BP recording, or maybe pulse rate, you are charting it. So by looking at chart in one glance, we come to know how it is increasing or decreasing. Then graphic sheet or flow sheet. So the sometimes now BP also, we going to write in a arrow mark. What is the upper arrow shows about the systolic, and lower arrow shows as a diastolic. This type of graphic chart, variance charting, that up and down how it is changes. So these are the some type of paper based documentation. Now the main thing is electronic documentation, electronic medical records, electronic health records, and other electronic devices. If you go to CT scan, they patient will be undergoing CT scan mission, but the SR, or maybe whoever the doctors or radio diagnosis doctor, will sit in the console room and they will just watch the computer. In computer, all these pictures will come, whatever the output, and that they're going to visualize and record it. This is simple technology where digitalization happens. So this is what the other type of electronic records, which will be shared anytime, anywhere. Now, next come to the basic question, that what is electronic health records? An electronic health records, or EHR, is an individual office health document that is shared among the multiple facilities and agencies. If you see here in the picture above, where nurse will sit and recording at bedside or clinical area, and what she recording, if you come down one, there is a computer based picture. That is what, where software involved. You just click over there and you will get the patient details, where you can chart, and it will be accessible to different physician, and also pharmacist, or maybe billing clerk. So everywhere it is a visible what you are recorded. This is what something electronic health record. Move on to further electronic health record in detail. It is a digital version of patient paper chart. Electronic health records are real-time, patient-centered records that make information available instantly and securely to authorized users. While an EHR does not contain the medical and treatment histories of patient, an EHR system is built to go beyond the standard clinical data. Means what you are writing only in nurse chart. Beyond that, you can able to write. Collected in provider's office, that is the bedside, and can be inclusive of broader view of patient care. So it is not limited only at bedside. You see, physician partially depend on nurse, whatever her observation, what she is sharing. When patient is difficult at night time, maybe 10 o'clock, patient is maybe semi-conscious, suddenly deteriorated. You are reporting a physician and a treatment doctor telephonically, and he will ask how the patient is, how it is eyes, whether what is the BP, whatever your report is, depends on. But if we have the electronic health record, whatever you are recorded, he can access from his home, either from mobile or maybe tab or maybe some home computer, whatever it may be, with the some password and all, so that he can see what exactly the patient vital signs. Before just giving the prescription, he can confirm. Further is the definition of electronic health record by Ministry of Health, Government of India. Electronic health record and electronic health record of health related information of an individual that can be created, gathered, managed, and consulted by authorized clinician and staff within healthcare organization. Which means that within the hospital, we only creates, gathers, and manage the data, and also consulted by authorized clinicians. So each time while recording, we may clinician is the consultant. He will guide us, and staff within the healthcare agree can be shared within the different personnel within the organization. Now, whether can we share outside the organization? Yes, that's what we are looking at. We wanted to improve in our healthcare system. It is not just limited within the hospital. It can be shared all other hospitals and also other country also, but it has some control. It has to be under authority of the management, because whatever the image of the institution should not go wrong. For that, there is some restriction what to be shared, what not to be shared. Coming back to the what is electronic health record contains. It is nothing but as you are recording in nurses chart in the hospital, same thing it contains. Contact informations, information about visit to the healthcare professionals, means how many times doctor's rounds has come and which and all consultant, maybe uh, a reference given to dentist, reference given to neurologist, and there whatever the outcome also they're going to record there. Allergies information, maybe patient is allergic to some medication. Insurance information, family history, immunization status, information about any conditions or diseases, a list of medications, a record of hospitalization, information about any other procedure performed. Sometimes what happens, patient may come after 10 years to the same hospital, and we have the re-registration or new registration, and old data we may not have. But that problem won't be there with the electronic health record. The moment you give some unique identification number, whatever the maybe 20, 30, 40, 100 years back also, information will be retrieved. This is the benefit of electronic health record. Now, what is the advantages of electronic health record? We can enlist n number, but I just made some of the very significant benefits or advantages only. Providing an accurate update and complete information about patient at the point of care. This is important here. So at the point of care means directly from bedside, you will get the accurate information, update, and complete information about the patient. Usually what happens, one person, maybe your own relatives admitted to hospital, you wanted to pass the information about the patient health status to maybe your uncle or maybe brother, someone, because he's also a clinician or physician, he wants some details. What you will do, you wanted those information, definitely hospital will stop you taking snaps of clinical sheet. So you need to interact with the treating physician, with your relatives who is a doctor. So what we will do, we will wait for that doctor to come. When we go, doctor may not be in the clinical area, he may be in OPD. When you go to OPD and put a word like this, he may give the consent, but he says that tomorrow 9 o'clock I will come over there. Then you may be waiting there, but physician comes 11 o'clock. This and all some clinical load what he faces. So at last you are waiting, not properly going to happen. At last what he will do, you will call him, your brother or uncle, and he will speak to them. That's all. With that, it is over. So what I mean to say, If it is an electronic health record, whatever the information directly can be shared. Direct pictures of clinical data can be shared, enabling quick access to the patient record for more coordinated and efficient care. Here it is something patient direct records is not only whatever you have recorded, it can be directly shared with now, for example, neurologist. Given the consultation, he has to come to the bedside and he will check and he will go. Afterwards, he may not aware, but if again he want to monitor the patient on his office only, he will get the information because whatever recording at the bedside, it will be accessible to the all clinician wherever they are in a either mobile or tab or computer, whatever the way. Securely sharing electronic information with the patients and other clinicians. So it is the information, whatever you have recorded, it can be shared with the patient also because nowadays patients are more concerned about their clinical data. Before, patient is not bothered, but now patient demands, can I have that paper? And it's also other clinician, maybe within the hospital, some other consultant, but outside the hospital also. Family physician is there. He want to see what exactly are the things. So for him also we can share if it is electronic health record. Helping providers more effectively diagnose the patient, reduce the medical error, and provide safer care. If you see that clinical scenario, one picture of one patient I just gave you. First thing is that patient had reported there is a bluish discoloration of his left thumb and tongue. That time itself, skin physician or dermatologist suspicious about carcinoma and he sent the biopsy, but histopathological report is not supporting. He dropped. So at last, no carcinoma. That same patient, after 9 months, reported to gynecology, then surgery OPD, then undergone some direct laparoscopic surgery. That is also wrong diagnosis of appendicitis. Otherwise, this patient may not get any carcinoma related information directly because wrong diagnosis, undergone some appendicectomy, laparoscopic surgery. They identified it is an advanced phase of malignancy. So here, if you see entire our medical system is done some error. So this is what I mean to say, reduce the medical error and provide safer care. Improving the patient's communication as well as healthcare. Improving the patient's and provider interaction, communication as well as healthcare convenience. Here basically provider interaction means healthcare provider interaction. Healthcare provider means maybe nurse or therapist or physician and patient. We can have interaction because on the ground you have the information everywhere. It is available in a computer. Further advantages enabling the safer and more reliable prescribing. Most of the public, not the nurses, but public complain that whatever the physician written medication not able to read. Maybe pharmacists, some extent they may able to understand because of clinical name or generic name, but otherwise most of people finding difficult prescribing because whatever the scribbling is not clarity. But if you have the computer prescribing, he has to write the order, doctor's order in computer-based format so that computer will clearly communicate what exactly the medication written. So reliable prescribing is possible. Helping promote legible, complete documentation and accurate streamlined coding and billing. Here, one problem is that most of time, especially in government sector, patient is operated for maybe cholecystectomy, but they will write herniorrhaphy or appendicectomy. Why? Because cholecystectomy, the charge, hospital billing may be more, whereas hernia or appendicectomy may be very minimum. So they just want to save the money of patient. They write like this. Fine, that is not an issue, but same patient later on come with the complications because of some infection, non-curing, and maybe diabetic, so many other complication comes means, then how this physician can defend, because he written appendicectomy there, whatever the inflammation and all occurs near to the gallbladder area or maybe liver area, then people will suspect that this physician, whoever the surgeon, is not accurate because he done the appendicectomy and the inflammation spread to liver. So this is nothing but a wrong documentation. This is where we are really facing. That's why when we take like these cases, coding and billing stands very important so that they cannot mismanage. Enhancing privacy and security of patient data. So now the question is, once we put in computer, it will be spread to everyone. No, there is a control. Don't consider that maybe you may take the snaps of patient data through mobile. Definitely that can be barred, but otherwise this data cannot be so easily shared until there is some IT cell where they have the total control. Whatever you are sharing, they'll be going to monitor. And if it is something wrong, may be blocked. This type of IT system can be established, and there is a standard. Later on, it will come how exactly it will be maintained. Then helping the provider improve the productivity and work-life balance. Now also people finding very difficult to day-to-day activities or their life and their work. It's not able to balance it. But if we have electronic health record, your recording is not repetition, because no one patient today come with some problem, you have done the thorough physical examination, then after this patient is not happy with that physician, gone to another hospital, there also he has to do the thorough physical examination. Why means that patient's data is not shared. So this is where I'm just telling, so your workload is increases. But if it is an electronic health record, it is the right way going to hand over to patient on the discharge. He can take that one, store with himself, and he can use for wherever he consulting later on. Enabling the provider to improve efficiency and meet their business goal. Like at last, hospital also have some business goal. They has to have this many patients we have to treat, and out of 1,000 patients, how many improve, how many died, how many means not improved, basically poor prognosis. So all this can be monitored directly with the electronic health record. Last one, reducing the cost through decreased paperwork, improved safety of patient, reduced duplication of testing, and improved health. All this electronic health record makes your um, like people may not be happy in the beginning to go a mall and purchase the things, but now people are more comfortable to go to mall than the ordinary jeansy shop. Why? Because jeansy shop, the things and all kept inside the custody of a owner, and if you demand one kg rava, and he will put and he will give. After coming home, you realize that rava having kida, so that you cannot retrieve at the point of purchase. But if you go to mall, it is a packed and ready-made, and with the what is the cost, price, everything is there, and you can check whether any kida is there or not. So this is what the mall type of shopping where customer is empowered, whereas the olden type of jeansy shop where owner or shop owner is empowered. Now, why EHR? Now, till now, I have told you advantages of EHR. Now, I am talking EHR, why we have to have. If you see the right side picture, so there teleconferencing going on. The physician from the direct clinical area giving some information, whereas students sitting in the office and watching his whatever the idea. Now, if you see, most of time, student go to clinical, maybe at a time 10, 15 students will be there. And they will just do, some people really interested, they do some clinical assessment, whereas other student may not. But when it is comes to a electronic health record, physician will directly assessing the patient itself can be recorded and it will be visible in the computer. This type of arrangement can be done easily, and physician not repeating the job for the student, he doing for the patient benefit and directly recorded, and it will be watched by student. This is what some of the why EHR, how it is beneficial. Healthcare industry now moving towards value based industry of patient care. Before and all, patient will just give the his consent to the physician. Whatever physician take the call, whether surgery has to be done, physician will decide. Whether angiography is done, physician will decide. But now, not so. Patient asks why angiography and what book picture literature says. And there is something called secondary opinion or tertiary opinion. So one physician, whatever sees is not final. They will ask within the family or maybe some relative, some other physician who is maybe some other uh, uh, means other state. So they will contact and ask like this, like this. Then they will ask the clinical data, and you will be sharing some of the clinical data. And he said, no, it is not necessarily surgery is not required. Don't go for angiography. This type of communication. Why? Because we don't know whether this organization only patient based care or they also have hidden interest of making money. So this is where we need to look into. That's why now the patient care healthcare industry become more transparent. They providing all the information to the patient, and patient has to take the call. Decision making is done by patient. Only information provided by healthcare team. When we talk about electronic health record, no more interoperable. Interoperable means within the organization you are operating. I was telling the previous slide that within the institution or within the organization, pharmacy, store, maybe different physician, nurses, everywhere can be shared within the organization. But interoperable means more than within. You have to can communicate some other. Now, for example, that clinical case scenario I have told you, Shruti but wanted to undergo surgery at Udupi, which means that all clinical data has to be shared. If not, all this, whatever the clinical diagnosis and report has to be redone at once again had to be repeat in the other institution. This is where the problem. So EHR no more interoperable within the healthcare industry alone. It can be shared other than healthcare industry, engineering cell, because it is not only if you see an healthcare industry monitor has to be prepared means it is not the health alone. Engineering input is there. So this that's why it can be shared with other industry also, so that they will accordingly prepare what we wanted. Digitalization of the patient care information is the key objectives of healthcare providers. So here digitalization of patient care information means everything will be put in a computer, and at a time just imagine in India itself, maybe Karnataka, one patient has come with a fracture of tibia. At the maybe at a time when one hospital, maybe Government College of Nursing Mysore, same time another patient went to Government College of Nursing Bangalore. That also fracture of tibia. Like that, if you see at a time, maybe within 1 hour difference, all over India, almost 30 patients reported to hospital with fracture of tibia. Now we just monitor all these 30 patients. Maybe after 10 days, if you see, maybe 15 to 18 patients improved and they're doing absolutely fine. Now these 10 to 12 patients, what happened? Two patients is dead, maybe five patients have poor prognosis, suffering still in ICU, and another three patients have some complications. This type of things, data can be assessed by digitalization of patient care information. It can be shared with the authority consent so that one healthcare industry research purpose and can be used at a time. This is the benefit of EHR. Otherwise, we have the clinical data, maybe 300, 400 patient itself a big number. But if we do EHR together, that is electronic health record of all healthcare industry together, we'll get maybe 40,000, 50,000 clinical data at a time. This is really boosting in research activity. And again, what exactly patient need at that point of time, that can be easily done. Electronic health record system are boosting the medical care system just 4%. Now slowly increasing everywhere they wanted digitalization. If you go to some private sector, especially Apollo or maybe Aditya Care, these are the people mandatory made everything should be recorded in digitalization automatically. So slowly picking up in some of the developed countries like UK and US, it is a mandatory everything should be recorded in the computer. EHR system implemented over all the overall benefit the patient care, user friendly, easy access to data, supporting existing healthcare. Again, I want to bring you one notice, clear notice that by changing into digitalization of patient care data is not going to harm any nurses because this is where we are. It is error is not happening only at your bedside. All over India it happens. So as a professionals, error won't be communicated. Just to take this clinical data for analyzing which is the best way to treat. And this based on this data, all the physician uses and which is the best method to treat the patient. That's all the matter. That's why not to be scared of while recording it went wrong, I may be targeted. So electronic health recording system implementation overall benefit the patient care, user friendly, easy access to data, and supporting existing healthcare industry. So it is not that existing whatever the healthcare industry we may trouble because of electronic health record. Electronic health record system overall help the data entry process and learning artificial intelligence. Now here one term is artificial intelligence. This is the term very simple. When if I am the owner of clinical data, for example, a physician, a neurosurgeon, some studies done in neurosurgery part, then neurosurgeon is the authorized. So whatever the data, he is the responsible. So that if you do some research study on neurosurgery patient, you have to acknowledge as a co-author for neurosurgeon because you used the patient from neurosurgery ward. But when we talk about artificial intelligence, as I said, at a time, maybe 40 patients all over India, you've taken the for analysis, and all these 40 patients of different physician in different hospital. So this data, who is author, who is owner of this data? Why? Because one hospital, one patient. So it is the 40 patient I. Nobody is the authorized or owner of this data. This data you have to approach through maybe government sector and some authority. Once it is got that one permission, then this data is nothing but artificial intelligence. So here you will get 40 number of orthopedic tibial fracture, same 1 hour gap distance, and that you generate the data and you say that, yeah, this is the best method to treat the patient. That is the information what all physicians want. This is simple logic of artificial intelligence. So lower the manual operation system, EHR based automation. Here automation means like if you go to some Google, you just type infrastructure. You no need to type all infrastructure together. You just INFR. By the time infrastructure is coming at the top. So you just click over that, it will automatically comes. This is nothing but automation. So when you go for any EHR, initially, yes, you may find difficult because you may not know the spelling properly. You start typing, but automatically later on it will come. Why? Because this is made as a automation form of recording, so that you just put blood pressure, BLOOD, then it will come blood pressure, then and then you can just click. So this type of happens in charting. Then again, charting, template, customization, all this possible. And like it is a does not require more input. When you handwriting means automation is not possible. You have to write infrastructure. But when you do computerized, so automatically some of the word comes, you just initiate the typing, by the time it will come and you click and get through. Why EHR? Electronic health record easily integrated existing system of billing, claim, processing, scheduling, lab finding, and two-way patient data sharing, etc. If you see computer, for in the beginning, nobody wanted computer to come into day-to-day activities. But now people are more comfortable by booking the railway ticket. By in one corner, maybe so interior of the India, from there they can book. So maybe one person in Mysore, from Mysore, he can book a train ticket from Rajkot to Delhi. So he never, no need to go to Rajkot at all. This is what the beauty of computer. The error happens very minimum, whereas human error is more and more. That's why now simple logic is from the Mysuru, you are booking a railway ticket from Rajkot to Delhi. That is all because your software technology, it is possible. And seniority, maybe when we book, we make the ticket and manually, we may consider our friend first. Though he's come last also, we may consider first. But when it is comes to railway ticket through computerization, there is no friends. Everybody on queue only. This is what the beauty of electronic health record. So because of electronic health record, existing billing, claim, processing, scheduling, lab finding, all this will be done very easily. But yes, in the beginning, you may find little itch, but later on, it is very easy one. Then here, two-way patient data sharing. Two-way means one is you are directly sharing with the patient. Another one is that you can use this patient data to some other patient. Because pehle this patient have come and he treated with this antibiotic, and that lead into poor prognosis. That's why we don't want to use this antibiotic. And this patient, previous patient, we asked to mobilize, but patient not mobilized, and he is wanted to lie down because he's little fatty also. And because of what is the outcome? His dislocation never cured properly. So now you have to involve more and more walking. Ambulation is very important. This type of teaching can be done by using the previous patient data. This is what the two-way patient data sharing. To tracking the medication history, visibility of scope of their practice. Now, medication history, as we know that sometimes we learn during second year BSc nursing when study the pharmacology, we study that okay, some of the drugs should not be given for pregnancy and lactating women. Some of the drugs should not be given for BP patients. So all this we study, but when we practice it, we are not bothered whether patient is pregnant and whether this medication is fine. So that also we are not aware. We may prescribe and we start treating, then patient comes with allergy and patient comes with some other problem. Then only we realize, no, this medicine changed. So this is one problem. And I will tell you further, in 1990s or 2000 आसपास में, so we wanted to go for library means only hard binded books. That only we have to read. But now it is so easy. We ask the question to student today, and student not make any effort to go and study, just Google it. You will get then and then. This is what the some transform and reforms in the education system. So this will boost by reducing more treatment error and benefit the medication management. Sometimes some of the medicine we may use, but we as well as we forget. So this type of error can be reduced by using electronic health record, because you have the clear data record. Finally, EHR reduces the manual retrieving, enhance the medication research. So you no need to search kya hua tha, maybe 5 months before one patient have come, how she is. You don't need to bother to see, because it's every data is available. You just put some tibial or maybe knee replacement. Immediately, all the knee replacement patient data will come. Maybe you have to put the date from which date to which date. So this is definitely enhance the medication research. Otherwise, what happens? So many people, they will go and sit in the MRD, take the permission from MRD officer and sit and do the recording or data collection from the charts. But now not required, ready-made available in the computer. Easier access to patient care data enhances the patient involvement in medical care and which lead better health care outcomes. So nowadays, we, because of electronic health record, we can directly teach. See, this is what your blood pressure already 180 by, you can show how the charting is. So we wanted you to come down this level from 180 to 140 at least. Then only you will be discharged. Otherwise, what happens? Patient repeatedly asking when I can discharge, when I can discharge. So he, everything is fine, but we are not comfortable because his BP is still 180. That has to be easily taught by electronic health records. So here,
Dr. Paniyadi, sorry to interrupt you.
yes,
Can we
then we'll move on to
the remainder? Yeah.
Yeah, thank you for giving again opportunity, because another 10 more slides are there. I will complete that fastly. But before that, I'll just address the Rose question. Like she also seconding with me that EHR definitely important and it is beneficial. Second one is still very, every bed don't have computer system. Definitely not required. Computer one at center, mobile also can be used as a supplement for the recording. If not, a tab can be purchased. So these are the way we can do. At the same time, yes, one system overall should be available so that some people can sit and comfortably can write up the clinical data. But otherwise, if it is available at least in a ward, one computer is more than enough, and there will be clear connectivity with the mobile and tab. That will solve the issues. The third question is, again, she asking about the manpower shortage. Definitely not. Existing manpower, like we know how much we are charging, that much definitely we can charge in a computer. And if at all required, maybe in the beginning, some orientation, we may need some computer expert, so that how to go about, how to chart, what going to happen. It needs some basic orientation. So then it can be done. But data managed by IT cell, that's why not an issue. What about confidentiality of the patient information and data while sharing? Yes, you are not sharing at all. And that should be done by a expert IT cell. And if at all you wanted, they may have the separate, because no, when you collect the data and sharing the data is different. So all the data what we collect, everything cannot be shared. That's why data carrying portal will be separate, will be there. There you can either cut and paste, or maybe some of the information then and there you can draft from the original document. And at last, what to be shared and will be scrutinized by IT cell, then only it will be shared. That's why, yes, confidentiality required. You are not directly sharing the data. Next one is Laila Nisha. Her address is data confidentiality ensured. That's what the matter, because somebody can scribble from some patient. In the reality, patient not have that issue at all. Maybe patient is suffering from carcinoma and stomach pain, and they simply add some, her BP is shoot up and hypertensive. Those things and information may derail the system. That's why yes, it has to be scrutinized to some extent. And who is sharing, who is transferring the data should be held responsible. So data sharing is not that much important at this moment. First, we are still not in the basic of digitalization. First, it has to be digitalized, means everything is should be in the computer. Then slowly data sharing can be come across later on. This is what I mean to say. That needs some quality check. Next come to another. The formality should be looked like another consent is required. Challenges facing at this moment, data sharing is not that much taken significant. With that, I will conclude these two questions. Let me complete my some more presentation. Yeah, this is what where we stopped here. Why it is the EHR? We have seen all those. Now the difference between electronic medical record and or electronic health record. What is the trend? What going to be? As it is integration and interoperability. So we need to integrate different system or different department together, and other than the health sector, other outsider also we have to take in the board. That's why interoperability is required. Cloud computing. Actually, cloud computing means external agency is handling your data. Sometimes the maybe PSC or maybe some small hospital they may not have ready to handle all this data. That's why we make in outsourcing. So that outsourcing agency will consider as a cloud. They use the um, all your data will be stored there properly. Now, standardization again, how to be stored and how much data you record, because sometimes now we may use some videos and all that consume more space. Robotic processes automation. As we know, it is a every day we generate the data. It has to be stored respective area only. One patient data cannot be go and sit with another patient. So that uniqueness and how to organize. Then automation, as I said, automatically it has to go and store in those places that need to be more processed, that need some IT or information technology input. Telehealth, most of time telehealth and telemedicine same, like that people have idea. No, telehealth is different. Here only we providing health related information, whereas telemedicine is where medicine prescription by the physician. Here telehealth means we are just providing information and as type of health teaching. That's why telehealth and telemedicine is slightly different. And artificial intelligence voice recognition. Sometimes we may tell something and later on we may withdraw, no, it is not my voice, somebody else. So that's why voice recognition, with that automatically the password and alone need to put, by just putting voice itself, it will open. Then artificial intelligence that already I told you, that need to be means automatically it will generate and will get more clarity on our data. Then error reduction, again in the beginning maybe error happens by the recording system itself because of poor orientation, may not know, little fearful although, but as the day comes it will reduce. The beginning of entering computer era also, people are scared of typing in computer. Blockchain EHR means it is a continuous, as I said, there is a electronic health record from different hospitals. Like now, if you see our AIMS itself, we have initially only AIMS New Delhi, but now we have almost 23 AIMS. So that may be become as a blockchain. One AIMS को contact किया तो automatically interrelated. Then 5G, 6G, and big data. Nowadays, as you know that 2G, 3G, 4G, now 5G also under the process. So as the more generation comes and more big data can be stored. Small instrument, we can store more data. This type of things is a trend for now. And wearable devices. So now what we have, laptop, computer, but we wanted a ready-made like a pager, somewhere you can wear and go and it can be used everywhere. So that type of devices, another things. Then real-time data analytics. Real-time data means how exactly data generated, how to analyze. Shorter period analysis is required because later on it become old data. Now future trends of EHR. EHR methodologies to lower the treatment cost, save the money. If you see, this is only the trends I am talking in the further slide, 3 slides. So basically, electronic health record methodology to lower the treatment cost and save the money. People think their computer, laptop, tab, everything is costlier. No. At last, no, it is lower your cost of treatment. Continue to deliver the necessary operations for the patients. More specialist involvement help the suitable solution and quick action and complex medical management model. Maybe so many physicians involved, not only the orthopedician from AIMS Bhubaneswar. At a time, so many other orthopedicians will look into the data and they will suggest, no, instead of going for the knee replacement, why can't you use this medication for 10 days and wait and watch? So like the treatment may be more suitable than the complex. EHR systems slowly transform into digital platform to the consumer. Actually, electronic health record is available and it will become a more customer friendly. And also user experience. People will come forward. No, this is good one because most of time, as I said before, reaching hospital only consuming time. The patient from the home who not able to mobilize, shifting to the car and bringing to the casualty, from there only bringing, it all takes almost more than 2 hours effort. Once he comes to the hospital, then he has to wait for a physician. But some of the information, for example, change of rice tube, not necessarily patient all the way has to come to hospital, can be guided through maybe mobile video call, or maybe one nurse can go and do easily than the transportation of the entire patient and health patient family members. Language and voice processing may be further streamlined for data entry and processing because now most of time consumes and space occupies. One is that your videos and another language because okay, I may be good in Kannada or maybe some other languages. So when it is comes to computer, I have to type in computer English only. This is not the problem. Maybe same thing if from German, he knows very good in German but he not able to know English. Such cases, voice recording, the moment you tell in German, the automatically computer software turn into English and type and put in the uh, maybe wherever clinical data entry chart. This is what the technology available and it may be can be used. So language and voice processing may be further streamlined for data entry. This is the trends. Then again, patient care will be boosted by easy access of the information in shorter duration with accuracy and lowering the error. So very short period patient get the information. Now sometimes you are in a city, maybe Mysore, you don't know where and all maybe some of the treatment like angiography, which at a hospital is done, and what is the cost of it. So like how in the market when you purchase, price should be like in mall and all price list already there. You can very easily do choose and collect. But when it is comes to healthcare sector, no, there is no choice at all. You just go to hospital and bill will come at the end. You don't know in between. If you ask, people will see differently that you are not able to pay the money. So that's the reason where they will ask you to go to government sector than the private sector. These are some big itch is there. For that to control, this EHR or electronic health record gives ready-made information like in the previous speaker, Dr. Riaz has said, by sitting at home, you can operate. You can get the food directly order for Swiggy, and you get the information of agriculture by searching in the Google. So this type of e-commerce, totally we can operate, and health related information also you will get ready-made in a this type of EHR platform. Helps to quick decision making, better patient care. Telehealth may be combined with EHR services for better service and tracking records. Now you may be running the telehealth services in your hospital, maybe interior people contacting through phone or video call, whatever. But you sometimes you may miss the information. What to tell you don't know. Such cases, if there is a how we have sent chat box or maybe previous history you can retrieve in a computer. So those things and all, if you ready-made available because of EHR service, then and there you can give. See, previously 3 patient SS Ayata, and they had this issue, and this can be controlled by doing this. So then and there you can answer and clear their doubt. Patient care mechanism further boosted through visualizing patient care setup and history of care. As I said, EHR service may be telehealth mixing of combining video call. You can just show the setup where the patient at home, how they staying, what are means bed, how it is, and where is the suction catheter machine, where is the food is kept. All those we can visualize through maybe mobile platform or video call. Chat box also helps to integrated platform enabling easily accessible for solution. Sometimes what happens, you have the issues, but you don't know the solution. Then chat box gives you solution saying that no, this is can be done this. So we can look into those also. That is because of automation. So these are the better information we get through EHR. Now we'll come last topic, that is EHR standards. Somebody already raised what is the how we can control this and how the data sharing and all happens. So if you just see in 2013 September itself, Ministry of Health and Family Welfare came out with the electronics health record standards. So it is already implemented and by force as a law by 2016. So goal of this standard is promote interoperability, which means that more and more people access to this data and operate in different sectors. This is the one of the main goal of this EHS standards. Then support the evaluation and timely maintenance. So means once we create, it has to be maintained and new information has to generate. Promote technical innovation, some research and how exactly new maybe foods and all we can generate by knowing the information. Further encourage the participation and adoption by all the vendor and stakeholders. Keep implementation cost low as reasonably as possible. Then consider best practices, experience, policy, and framework. Like already, Sir Ria sir has said, information communication technology infrastructure. This is the one of the basic standards of EHR or electronic health record. Creation of the basic information communication infrastructure or technology infrastructure has to be created, and creation of national secure health net, creation of storage and exchange of infrastructure, use of free and open source of software, use of personal health record system. These are the some of the standard comes under the information communication technology infrastructure. Second one, IT policy and regulation. Already this is the best solution for confidentiality, how secure you are sharing. So national health IT policy, protection of privacy, sharing of health information, use of health information, liability of technical failure. Sometimes you everything is done, you sent also, but there is net connectivity is poor and it is not reaching. So such conditions and all, liability of technical failure also one of the standards under IT policy and regulation. Standards and interoperability. If you see in this picture, the data comes and stores some area. From there, it has to go to sharing business. So sharing business not done directly from you. There may be some expert will sit and what information they wanted, that much only they will share. Something like that we need to be controlled. Establishment of agency for healthy IT standards, use of unique patient identity, confirmation of testing facility, support for adoption and of standards, guidelines for health IT solutions. These are some of the standard of interoperability. Then finally, research. This is what the further development, research and development in the health, IT, human resources development, development of online course of where we know that malware and all that how to control that, dissemination of the best practices, international collaboration, not only our own practice, some other area also we can incorporate. With this, I will stop here. These are some references. If any questions.
Yes, so there's one question from Mosumi Sarkar. Mosumi, do you want to come up? If you want to come up, just raise your hand. Okay. But she's asking, what is interoperability?
Interoperability means it is not only the healthcare personnel alone operating the information. For a simple example, I have the clinical data of one patient, what and all the test is done, what and all the investigation is done, what treatment I have initiated, already there. That I need to share because patient is going some other hospital, I have to share that. So if I give the information directly to the patient may not understand what it is. Then what usually physician tells, you go there and tell that physician or the doctor, give this number. I will directly contact him and share your information. So this is what the interoperability means. You are operating your information from not within the hospital, you are sending to another hospital. That is one way of data sharing. But another way of data sharing will becomes for research purpose. Some of the maybe health professionals, they wanted some data or they wanted some information relating to patient. So they wanted directly from the clinician or maybe hospital. So that also interoperate because here nothing to benefit the patient. But in a large, it is benefit the patient. Why? Because they will collect the data and they will mix up with so many data. Finally, they come out with the solution that may be used for public treatment. But otherwise, directly, the patient information may not be useful to the patient. So this is another way of interoperability. The final interoperability is not only patient alone, maybe another patient in one hospital. Now patient is recovered and all in AIMS Bhubaneswar. Another hospital, Mysore Government Hospital, their patient undergone same problem. So they using this patient data and teaching their patient. You have to do this, otherwise your improvement is delays. This also some means using this patient data for benefit of another patient recovery. This is what another type of interoperability. Overall interoperability means your data is operated by so many people in so many purposes. Sometimes for the same patient, sometimes for not for the same patient. This is what interoperability. I think I have clarified your question of interoperability. Any questions?